So that was an example of a molecular testing report in someone who got a tissue biopsy. But what about someone who we did a liquid or blood biopsy on, meaning we did molecular testing on the blood? So here is an example of a patient who had molecular testing done in the blood. Similar to the tumor biopsy report, this is a summary page where it's highlighting the molecular alterations that were found in the blood. So in this patient had an ALK fusion. And just like the other tissue report, this report also lists the FDA approved therapies for this specific ALK fusion. The report also mentions other biomarkers that are detected in the blood. In this patient, it's TP53. Just to make note, in the blood, the report will also sometimes mention copy number, which is just the number of copies of a specific alteration as a percentage of the total cell-free DNA in the blood. Again, for that, that's really primarily, it doesn't necessarily influence our treatment decisions, but again, important to talk about with your medical oncologist. But right now, we're not using the copy number to really decide our treatment recommendations. The other part of the molecular testing report on blood that was also seen in the tissue report was this tumor mutation burden here that's listed, as well as the microsatellite instability status. Here you can see that in the blood biopsy, they mention a tumor fraction, which just, which is basically the amount of circulating tumor DNA as a percentage of the total DNA in the blood. And very similar to the tissue biopsy report here in the bottom of the page, we can see here that in the blood, we find other alterations, but we may not know what their clinical significance is. So here on the bottom of the report, they're mentioning a list of those mutations that fall under that category. The other thing that Dr. Marks mentioned about liquid biopsies or blood biopsies is that they're non-invasive, and so because it's taken from the blood, we can get blood biopsies done at different time points. And so on the report, what you might see here is that if you've gotten a blood biopsy before and then got another one later on, sometimes the report will mention the change in the amount of copy number of that specific alteration over time. So you can see here in this report that between October 2023 and October 24, you can see how some of the levels of that copy number can change. But and that shows up here for this specific report as a tumor response map. The other thing that will be helpful as far as getting another blood biopsy is identifying any new alterations that can show up as a tumor changes with initial treatment, so that can show up on the report as well. So in summary, molecular testing really has helped patients with lung cancer. It's really helped us personalize cancer treatment with patients with lung cancer. It can be done both on tumor biopsies or blood biopsies. As the technology for molecular testing advances, we're now, doing both DNA and RNA sequencing on tissue biopsy. And again, it's very important to review that information from your molecular testing report with your doctor to determine the most appropriate cancer treatment plan. It's a lot of information in your molecular testing report, but it's certainly very helpful information. And I hope that this really empowers you to bring that information to your doctor so you can make a shared decision making about the best treatment plan for you. All right, thank you.